Almost 20 to 8 Monday morning. Did your partner keep you awake last night snoring? Well, apparently a staggering 8 million of us have our sleep disturbed by a snorer every night, and many sleep in separate beds as a result. Caroline Mysak-Douglas's husband often sleeps downstairs because her snoring is so bad, and they've been kind enough to let us into their lives. Here's her video diary.
It's Friday night and it's about 10 o'clock and I'm just about to go to bed. I'm sleeping upstairs while my husband Neil is downstairs sleeping in our room. At the end of the week he's really tired, busy week. I don't think he'll appreciate me waking him up with my loud snoring. It's about 6 o'clock. I've just woken up. Saturday morning, not too bad asleep. Not conscious that I woke up at all during the night.
You see, it's a tough problem to crack, tough nut to crack. Caroline and husband Neil join us now from their home in Edinburgh. Good morning. Can you hear me okay?
Yes, we can.
Good morning.
Good morning to you. How did you sleep last night? Probably not very well thinking about this in the morning, I'd imagine.
Well, I had the kit that the sleep clinic had given me to monitor my sleep patterns last night, so I felt a bit like, you know, an MI5 agent in bed.
How bad does your snoring get? Do you know when it's bad yourself?
Not at all. Not at all.
No, but Neil, you know when it gets bad, don't you? How does it affect you?
I think it's one of these things that, you know, you're waiting for it to start almost, and then, you know, particularly if you've been woken up at 1 o'clock and maybe 2 o'clock, and it's very difficult to get back to sleep, and then you're waking up again, so you just feel tired and grumpy and ratty. Yes,
and probably unable to work or perhaps concentrate quite as you would like at work the next day, because it sort of builds up, doesn't it?
Probably. It does build up. I mean, the interesting thing, it's different to, for instance, when you've got small kids, when you seem to be able to get back to sleep when you're woken up. But yeah, it does build up. And again, as you said, we quite often are sleeping in different rooms, so it's not so bad, but it would be nice to sleep together again sometimes.
We do.
Of course.
Just sort of move around in the night a little bit.
Yeah, it's really very, very difficult. And what treatment have you sought, and how easy has it been for you to find treatment, Caroline?
Well, I used the usual over-the-counter products and tried those, and they weren't very successful. And after about 5 years of delaying, I went to the doctors, and they referred me to the Edinburgh Royal Infirmary Sleep Clinic, and they've given me some advice as to what they can do. They're going to try and identify why I snore, and it's possible that I'm just a classic snorer, or I have sleep apnea.
Yeah, I tell you, it sort of seems amusing, but I know how destructive this could be and how difficult to live with. Thanks for joining us this morning. That's very, very kind indeed. Perhaps a classic case. Let's ask our expert, Dr. Bhik. Kotecha, good morning to you.
Good morning.
Is this a classic, this one?
It's a very common presentation. You know, patients are on the verge of marital disharmony, having to sleep in separate rooms. The snoring was quite disturbing, and what we need to establish is whether she's a simple snorer or indeed got problems with obstructive sleep apnea.
And what does she need? Look at all this equipment that you have here. Could you take us through this?
Yes, of course. First and foremost, she needs a sleep study to identify whether she is sleep apneic or not. If she is, then she will need something like this, which is called nasal CPAP.
Is apnea where you stop breathing?
You get an upper airway obstruction, you stop breathing, and you get deprived of oxygen.
Which is, you know,
which has a detrimental effect. Well, long-term, yes, there's a higher incidence of ischemic heart disease, getting strokes, type 2 diabetes, and lots of other medical problems. So you need to treat this. So the patients would need to have this every night. And this is dramatic. If they have sleep apnea, it's 100% effective.
OK. Wait, I mean, you can't sleep very easily with that.
You can't, and if they can't...
We have spoken to people who've said they get used to it, haven't we? People who have had those, and they do get used to wearing it. So.
Sure.
So that's one solution?
That's one solution. If they can't get on with that, then for mild sleep apnea patients and simple snorers, you can get something like this, which is a mandibular advancement splint. This is put inside the mouth, and it protrudes the jaw forward. And by doing so, the tongue comes forward, and the patients can breathe better. Of course, with appliances, the problem is that patients don't like it. They have to use it every night, so they want one-stop solution. And if patients do not have sleep apnea and they are what we call simple snorers, then they could have their snoring evaluated and can have surgery. And the latest thing in surgery are these two gadgets that I brought along with me. This is a radiofrequency probe which is applied both to the palate and the tongue to scar the palate so it doesn't vibrate as much. And for the tongue, it debulks the tongue, so the tongue volume diminishes and doesn't obstruct the upper airway.
No, is that not painful?
Not as painful as the good old-fashioned laser that we used to do.
No,
This is new development.
It's a growing business for you. It's a growing business for you, isn't it?
And the latest development is this implant. This is an implant that is inserted in the patient's palate, and it's like a little gun, and you just put it inside the palate and press the trigger, and it drops an implant within the palate.
Wow. You've got lots and lots of toys there. I know you can only see 20 people a week, and you're a real expert. I guess that we need more experts to help people like Caroline and Neil. Thanks ever so much for your time this morning, guys, and the very best of luck as you try and solve the problem. And Dr. Bhik,
they still look happy, don't they, though?
Well, you know, absolutely. You can take a test, actually, on GM.TV to find out if you're getting enough sleep, plus more facts and advice about snoring and all that sort of stuff. GM.TV.